don't take these medications with coffee. So obviously a lot of people think about what medications they're taking and what supplements they can combine, but people don't often think about the foods and the drinks that they're eating. And there are lots of medications that can be affected by the presence of food in the stomach. There are lots of medications that can be impacted by alcohol or can impact alcohol. There are lots of medications that react to things like grapefruit juice. But there are equally lots of medications that can be interfered with when you drink coffee. So in this video, we're going to focus on coffee and caffeine particularly. And there are a number of medicines that are impacted by caffeine, coffee. The first one being thyroid medication. So if you've got an underactive thyroid, the doctor will have prescribed you thyroid hormone in a tablet form. And thyroid medication is massively affected by food and drinks and medications, minerals. So you have to be really careful with thyroxine, because if you don't take it properly, then you don't get the benefit and your thyroid function might not be quite as good as it should be. And we know that caffeine can impact the absorption of thyroid medication and reduce it quite dramatically. So the general guidance is to wait a minimum of 30 minutes from taking your thyroid medication before you have that morning cup of coffee or morning cup of tea. But actually, if you can wait 60 minutes, that's even better, because that makes sure that if you're the sort of person that clears caffeine quite slowly, that you're still not impacting the absorption of your medication. So I always advise people to keep their thyroid medication at the side of the bed, so that as soon as they wake up in the morning, they can take it, so that by the time you've done your morning ablutions, you've been to the loo, you've had a shower, you've got dressed, you've fed the dog, then that time will have passed. So you're not having to wait, sort of, tapping your thumbs, waiting to see if it's time for you now to be able to eat and drink. So that can be quite a useful tip for some people. So leaving it on your bedside table is perfect, and just doing it the minute you wake up can be really, really useful. Mixing coffee with antidepressants can lower the absorption of your medication. This is particularly true of SSRIs, things like sertraline, fluoxetine, citalopram. So if you are taking antidepressants, again, it's well worth waiting 30-60 minutes to separate, so that you're not blocking that absorption. But there are also some antidepressants where the side effects are increased. So caffeine is metabolized in the liver by liver enzymes, and medications are often metabolized by the same liver enzymes. So if when you have coffee alongside or at any point in the day with your antidepressants, if you're noticing that you're more jittery than normal or that your heart is racing, then that would suggest that the caffeine isn't mixing very well with your medication, and you either need to reduce your caffeine or speak to your GP and get your medication reviewed. But it's really important to be aware of the impact that it can have on those medications. Caffeine can also slow blood clotting, so it can make you more likely to have a bleed. So if you're on anticoagulant medication, if you're on things like Warfarin, apixaban, clopidogrel, then it's an important thing to be aware of, that too much caffeine can impact that clotting process. So we normally talk about having no more than 2 cups of caffeine, be that Coca-Cola, coffee, tea, per day, so that you're not having a massive impact on blood clotting, but that you also keep an eye out for excessive bruising on the skin as well, that would suggest that your clotting is not as good as it should be. If you're taking Warfarin, it's really important that your daily routines are quite consistent. So avoid having massive changes in any dietary measure without having a corresponding blood test to make sure that your warfarin levels haven't been affected. So if you're taking warfarin and drinking 6 cups of coffee, don't suddenly go to 2 cups of coffee without coordinating that with the clinic, because we need time to react to that change. But generally, if you're on any of the other medications, the sooner you can reduce the caffeine, the greater the reduction in risk from doing that. Iron supplements, drinking coffee or tea with iron supplements, iron medication can actually reduce its effectiveness by 50 to 90%. And this is also true for iron-rich foods as well. So it's really important if you're being treated for anemia or if your iron levels are on the lower side, that you avoid tea and coffee within 2 hours of medication, and 2 hours of iron-rich meals as well, so that you maximise the absorption and get your blood levels back to where they need to be quite quicker. Caffeine's also a problem with blood pressure medication. Caffeine causes the blood vessels to narrow. It increases the risk of adrenaline, and that increases your heart rate and your blood pressure. And this usually occurs within 30 minutes of consuming caffeine, and can last for as long as 4 hours. So, of course, if you're on blood pressure medication, it makes no sense at all to be drinking caffeine alongside, because that's obviously going to be undermining the impact of your blood pressure medication and puts you at risk of having to have more medications or higher doses to counteract the impact of the caffeine. So do think about that, because that can stop you going down that polypharmacy 5, 6, 7 medication route. Now, some people build a tolerance to caffeine over time from a blood pressure perspective. But in some people, it can increase your blood pressure by as much as 15 on each number, the top and the bottom one, which is quite a significant increase. So if you think you're the sort of person whose blood pressure is being affected by caffeine, then obviously do look to reduce it. There are lots of nice decaffeinated coffees that are Swiss water decaffeinated rather than chemically decaffeinated. And then there are lots of nice herbal teas that you could put in instead. A lot of herbal teas are quite good from a relaxing perspective, so can help to lower blood pressure because they're calming you down and reducing you. So my general advice is to always separate from medication by a minimum of 1, if not 2 hours. And if you can, limit your consumption of coffee, tea, Coke to 2 cups per day from a medication blood pressure interference perspective. So I hope you found that useful. I'll be doing lots more of these videos going forward, so do make sure that you drop me a like and some comments on this video. If you've got any questions, I'll happily answer them. And make sure you subscribe to my channel so that you're alerted when new videos are around. And I hope you've enjoyed it. Share it with your friends, and hopefully I'll see you in the next video, and thank you for watching.